So halitosis can be caused by a number of different types of bacteria niches. So let's talk about different products that you can put in play in your oral routine that can help in certain niches. So let's just talk about the niches quick. So halitosis can be caused by gum lining type of bacteria. Those bacteria are responsible for periomouth, essentially. So if you have gum tissue inflammation and bacteria that causes that inflammation, there's a specific smell when it comes to periodontal pathogens. So making sure that you're getting in on a regular basis with an electric toothbrush, getting at a 45-degree angle, and getting at the gum line with that toothbrush to make sure that you're disrupting the bacteria along the gum line is super helpful for those gum line bacteria. Then make sure that you're flossing. We have expanding floss. I think expanding floss is fantastic because you're actually grabbing the bacteria. Make sure you wrap those around your middle finger and use your fingers and your thumb to adapt the floss appropriately so that you're pushing a C shape against the tooth, going up and down and clearing that bacteria that can be lined along the gum line. And then another thing with lining the gum line is make sure that you're using a water flosser. So water flossing helps to remove any bacteria and food debris that may be trapped in that gum line area as well. So if it's not gum lining bacteria, then you definitely want to consider making sure that you're tongue scraping. So tongue scraping or tongue coating bacteria can also be a causative factor when it comes to halitosis. So daily tongue scraping, we have a number of different tongue scrapers, is super important to help reduce the bacteria that can cause some halitosis issues as well. Find the right tongue scraper for you and tongue scrape at least twice a day. And then finally, another thing is the back of the throat. So if you are struggling with post-nasal drip in the back of the throat, then you should probably consider also doing some nasal irrigation. So when you have bacterial overgrowth in the sinuses and that's dripping down the back of the throat, that can also be causative for halitosis issues. And then if you don't get any relief with some of that after using some antimicrobial rinses, possibly our breath harmonizer to reduce some of that bacteria after you're brushing, flossing, tongue scraping, and using a water flosser, rinse with the breath harmonizer. This is showing to give relief for up to 12 hours according to our research. Then look at your gut health. If that's not working, check into some gut concerns.